Hello, my name is Autumn Hildebrand, and this is all of our pregnancy presentation for special populations.
My name's Colette Duran.
I'm Jacob Kenoyer.
I'm Noah.
Then I'm Carlos Curlo.
So the introduction of our client's name is Miss Smith, and she's 35 years old. She's 150 pounds, and she's obviously pregnant. And her activity level per month and week is she works out 7 days a week. Her current physical activity behavior, she's extremely active and she maintains 0 days of rest. And she goes throughout her week with vigorous days of exercise, but does not give herself any rest and ensures that she does moderate strength training workouts every single day as well. Her nutritional habits are low, and she just genuinely believes that as long as she's working out every single day and doing these vigorous activities, that she doesn't need to focus on her nutrition, which is absolutely incorrect. For pregnancy and complications, some forms of complications that can come from just being pregnant in general and from exercise with no rest is she can have some forms of heart disease and lung disease. She can also have preeclampsia or high blood pressure that develops from the first time during pregnancy. She can have cervical problems, placenta problems, preterm labor during current pregnancy, premature rupture of the membrane, and severe anemia if she's not giving herself the proper nutrition that she needs. So also for lifestyle choices leading to possible complications. So her personal lifestyle choices is that she works out religiously, and she maintains poor nutrition choices, and possible complications leading from that due to her lifestyle choices are neurological development because she's not providing her baby with proper nutrition in the womb. They can also have cognitive behavior issues, fatigue in the mother, and increased chronic inflammation in the mother.
Okay, and then because she has pregnancy, there are different and multiple treatments, and there are holistic treatments, and holistic treatments focus on treating the physical, emotional, and environmental, such as the spiritual aspects of the client as well. There are relaxation techniques because when a pregnant woman is stressed, that stress can also affect the child as well. There's also Lamaze, which is just patterned breathing, which is a breathing technique that is also allowed, or not allowed, but inspired to help with labor. And then there's emotional support. There are groups that mothers can go to when they're having issues, aromatherapy, and then acupuncture. And then acupuncture is useful for relieving morning sickness.
So exercise during pregnancy has been shown to have positive effects on both mother and child. Research shows that women who regularly exercise during their 9 months of their pregnancy have had a lower risk factor in any kind of early births or C-sections. They also report that they have lower pain throughout their pregnancy. And a specific exercise is jogging. So women who jog while pregnant have reported that they had decreased their lower back pain and also have an increase in mood and it just helped maintain a stable pregnancy, a healthy pregnancy weight while they were pregnant with their child. And then for the child, once the child is delivered, it also showed that the babies were born with healthy birth weights and lower autoimmune disease if the mother exercised well during pregnancy.
So when doing exercise testing, it's important to be cautious because they can't handle as high of an intensity. And so it would be good to do something like a submaximal VO2 test, and that way you can extrapolate the results there and estimate what the VO2 max would be in order to have a more accurate program. So if they don't have any contraindications and there's a physician present, then it's okay to do something like a maximal test. Some of those contraindications are restrictive lung disease, ruptured membranes, heavy smoking, uncontrolled hypertension, and chronic bronchitis. And there's so many others, but if they don't have any of those contraindications, then it's okay to do a maximal VO2 test.
So exercise prescription is the common recommendation is at least 150 minutes of moderate intensity aerobic activity. But obviously, if a person is already very active and is already doing more than that, they are usually cleared to do more than 150 minutes. And then resistance training and cardiovascular training can both, when done properly, can show benefits. And then for this specific client, like we said, she works out 7 days a week, is already super active. So she is going to be able to do the more than 150 minutes, but she needs to make sure that she is having rest days and spreading out her exercises throughout the week.
And then moving on to nutritional advice, it's important to look at kilocalories, carbs, proteins, fats. So for kilocalories, they recommend an increase in 300 kcals per day over the course of the pregnancy, and carbohydrates to be about 175 grams per day, coming from complex carbs such as whole grain breads, dark green vegetables, leafy greens, fresh fruits, and proteins should be about 25 grams per day, coming from lean meats, poultry, fish, and then fats should be a healthy source coming from omega-6s and 3s, 13 grams of omega-6s, and about 1.3 of omega-6s per day, coming from things like fish. So maybe like a sample meal would be a salad with kale and spinach, and then like a healthy fat such as avocado, and some proteins such as fish, carbohydrates like quinoa or maybe like brown rice or something, just in order to get all the macronutrients in that meal.
So overall, this program was designed for a 35-year-old pregnant woman who is already very active. There are many considerations and contradictions to keep in mind when creating an exercise program. The client has several different options for holistic treatments. Exercise is important because it provides beneficial effects throughout the whole pregnancy and throughout labor. It is important that all guidelines are followed in order to reduce the injury instead of increasing injury risk. And then proper nutrition is also a major role and should be considered, especially with this client already not caring a whole lot about her nutrition.